Should dentists be prescribing steroids after dental surgery? This question was brought to me by a dentist, and she offered this question. Hello, I wanted to ask about post-operative dexamethasone and risk for thyroid problems in a patient who reports no health history. We routinely use dexamethasone for 2 days after surgery to minimize swelling and offset the need for narcotics. Just wanting to know what else I need to be screening for so I can minimize risk for patients. I will already not prescribe post-op steroids if extremely anxious, or if the patient has a history of GI ulcers and perforations. Thank you for your input, Dr. Blank, a dentist. So there's a whole bunch of questions embedded here, and 2 of them I'm going to answer in this video, and then the third I'm going to answer in another video. And that's her last question, which is what else I need to be screening for. So check that out in a different video. But I want to focus on the first 2 questions, the risk for thyroid problems and the question she isn't really asking, but is actually underlying this whole thing. And is it, should we routinely be using dexamethasone in patients post-op? And I'm going to address that one first because I think it is the most important underlying question we need to address before we can move on to those other topics. So first, I want to congratulate you as a dentist and any other provider and prescriber who is minimizing the use of narcotics, who maybe in routine practice in the past would give every patient some Percocet and some dexamethasone after surgery, and that was just routine. And thank you for getting rid of the Percocet and other narcotics because that is really helping us to minimize the opioid epidemic and keep people unexposed to those medications that can lead to addiction. So basically, is dexamethasone a good alternative? Is this really truly offsetting the need for narcotics? And based on the latest practice guidelines for the American Dental Association and other studies, I would suggest probably not, actually. So let me share some statistics with you. They did a meta-analysis of lots of studies to see are corticosteroids, whether it's dexamethasone, prednisone, betamethasone, any other steroid, whether they are effective for post-op pain. And in this meta-analysis, they discovered that corticosteroids provide trivial pain relief. When pain is rated on a 100-point scale, with a 100 being the worst and 0 being zero pain, steroids only helped approximately 8.79 points, 6 hours post-op on that scale. So less than 10%, right? When we were looking 6 hours post-op, and then 24 hours post-op, it only reduced it by 8.89 points on a 100-point scale. So it's not even a 10% pain relief. And the authors of the study said that's trivial. It's like basically not statistically or clinically significant. There is a difference, but is a less than 10% difference in pain worth all the possible side effects that steroids can cause? And that's what I really want to help prescribers appreciate are those actual risks, because we've currently established the incredible minimal benefits of treatment, right? 8 points on a 100-point scale is all you're getting. And that's for pain. And they did other studies looking for swelling or trismus to see if those things have any benefit. And while it was statistically significant for swelling and trismus in third molar extractions, it wasn't minimizing the pain significantly. So are those actually, like especially the swelling, is that an actually clinically relevant, like patient meaningful outcome? Like, do they actually care if the swelling's down if the pain isn't down, right? Like, does swelling actually matter or does the pain actually matter? And so, yes, while steroids may help with swelling, does the patient even care? They can't chew very well anyway. They're stuck at home. They're not at work anyway, right? Like, does that even matter? Yeah, it probably does for some people, but let me explain why in comparison it may not matter. If we know that steroids are not providing effective pain relief, what's the cost for that 8% reduction in pain? Steroids can cause more side effects than any other drug. A neurologist said this is the world's most hated drug. A professor that I learned from at Harvard Medical School said that steroids are the most effective drugs in rheumatology, not dentistry. And they're also the worst drugs in rheumatology because of the side effects. I'm going to use that word, routinely get calls from people saying, my doctor prescribed steroids for this pointless reason, fill in the blank, whatever it is. And now I am suffering so much. I have psychosis, I have anxiety, I have blood sugar changes, I have urinary changes, my bones are breaking, I'm losing teeth, on and on and on. There are 150 side effects that I've personally been able to document, and there's probably more than that. And they're horrific. Like, most hated, worst drug that exists. Like, worse than opioids, right? Like, the side effects of steroids are worse than side effects of opioids, and opioids caused an epidemic. What I want to propose to you today is that steroids are worse than opioids. Please stop prescribing them routinely. So those studies also showed no significant reduction in infection rate, dry socket, or other complications. And then if they compared it to NSAIDs like ibuprofen, naproxen, they were more effective for managing pain than steroids. And then combining NSAIDs with acetaminophen, which is also known as Tylenol, gave even better pain relief. And you might be like, but I'm a doctor. I want to prescribe something. What should I do? Prescribe over-the-counter medications. They probably have them at home already. They're more effective than the prescription stuff. That's what the evidence shows. So according to the guidelines of the American Dental Association, I'm going to read it directly. Corticosteroids are not recommended for routine use after dental surgery. And there may be a few select cases where they're appropriate. For example, facial trauma with a lot of swelling, or a whole lot of dental extractions, like pulling out all of the teeth. And when there's severe swelling, okay. But like routine use is not a thing that we should be discussing. Like, steroids should not be routine use. They should be for select cases that are based on a pre-existing reason that is going to lead to extreme swelling. We should not ever routinely be using steroids. There's no justification for it at this point. With the research that currently exists, there's no justification for steroids. Finally, I promised to answer this dentist question about thyroids. So, what possible connection might there be with prescribing dexamethasone and a person with no previous health history suddenly having thyroid issues is what I'm inferring this dentist is asking. And that's just not very likely. The dentist is asking, should I be routinely, checking if somebody has thyroid issues and not prescribing steroids? And I'm saying you should not be prescribing steroids, period. But if you want to screen for something, thyroid probably isn't something you need to screen for, because while there is definitely a connection, there's the hypothalamic pituitary adrenal thyroid axis. They connect. There are hormones that are being sent, signals between, that taking dexamethasone and other steroids interrupts that connection and may trigger thyroid issues, may trigger adrenal issues, may trigger hormonal issues in the sex hormones. All of those are possible with dexamethasone and prednisone. But when it comes to thyroid, it's not like a super likely event. This is not something I would personally be screening for as a prescriber if I was prescribing. Thyroid is just not a frequent enough thing to be worrying about in my book. What she did mention was GI issues and ulcers, which you could be screening for, but that's especially if you're prescribing them to take ibuprofen along with it, because then it's actually a drug interaction, and that's a harmful drug interaction. Yet again, another reason not to be prescribing dexamethasone, because it's leading to a drug interaction with the drug that actually works, ibuprofen, which is going to lead to increased risk for ulcers. So just avoiding the dexamethasone probably means you don't need to worry so much about the GI complications. But I definitely agree with screening for psych issues, mental health complications, anxiety, depression, psychosis, hallucinations are side effects that can be caused by prednisone or worsened by prednisone. So definitely screen for those. I definitely agree with that. And then, like I mentioned, I have a whole video all about what to screen for when prescribing prednisone. So I'll go in depth about that. Check it out now.